So this is just going to be a very brief lecture on essentially cutting the strands of your sutures as well as suture removal. So when we talk about scissors, case in point, we in the operating room would love to use Mayo scissors. We would never want to use our Metzenbaum to cut suture material. It will dull the Metzenbaum too quickly. Most of your suture scissors actually come with a slight bevel, and that helps you mainly to remove the suture, not necessarily in terms of once a suture has been placed, cutting these strands. Now there's lots of discussion about what is too short and what is too long. The easiest way to do this is to hold both strands up. You want to go down essentially to the knot and then curve and angle your scissors completely and then cut. If you do so, you'll end up with strands that are not too long and certainly not too short. A few things that you need to think about. Number one, if you have in fact placed 6 hitches or 3 square knots, which is what you should be doing to tie a simple interrupted suture, you don't want the last knot to be so close to the tip of the suture material that it would actually back out and subsequently unravel. You don't want them so short that they're difficult to also take out if these happen to be external, non-absorbable sutures. Furthermore, you don't want them so long that they would become problematic for the patient, that they would catch on clothing, catch on sheets. You just want to make sure that they're appropriate. So if you take the scissors down to the patient and simply angle them completely to the side and cut, that is typically about the width and then some of your suture scissors themselves, and that should be appropriate length for the ends of your suture. Now, removal is easy, and as we discussed in the lecture, if you were to have multiple sutures on either side of this incision, we would like all of the knots to be sitting first and foremost off of the wound so that they do not have any type of clotting or any scabbing that would be over them that would make it more difficult or potentially cause an increased risk for infection for the patient. And also, you just makes it easier to simply remove them. You want to grab the knot itself, pulling up, again using that angle that we have in our suture scissors, simply cut the base, and then you want to pull essentially perpendicular to the wound. So pull opposite. I don't want to necessarily pull straight up, that might be uncomfortable for the patient. If you just pull in the line in which the underlying suture had been placed, that's typically much more comfortable for the patient. Similar to when we discussed staple removal, always go for the ones that look easiest first, and then leave the ones that potentially have more scabbing or more type of discharge over those sutures to the end. That certainly allows for a more compliant patient.